We'll go ahead and get started. I want to share this brief synopsis of why it's important to have cultural intelligence training. In our increasingly interconnected world, the ability to navigate culturally in a diverse setting has become an indispensable gift and skill. As society grows more globalized and workplace become increasingly diverse, the need for cultural intelligence, the capability to function effectively across cultures, has never been more pressing. Cultural intelligence, also known as CQ, is a training that seeks to provide a comprehensive framework for developing and enhancing cultural intelligence, equipping individuals with the knowledge and tools necessary to thrive in culturally diverse environments. Cultural intelligence, or CQ, refers to an individual's capacity to adapt and function effectively in situations characterized by cultural diversity. It encompasses a multifaceted set of skills, including the ability to understand and appreciate cultural differences, adapt one's behavior to different cultural contexts, and build meaningful relationships across cultural boundaries. Developed by scholars P. Christopher Early and Soon Ang in 2003, the concept of CQ has gained widespread recognition as a critical competency for success in today's global landscape. The importance of cultural intelligence cannot be overstated. In the realm of business, organizations, school districts, etc., that foster a culturally intelligent environment, better positioned to navigate cross cultural challenges, capitalize on global opportunities, and cultivate a diverse and inclusive environment that attracts and retains top talent. In the public sector, cultural intelligence enables government agencies and civil servants to better understand and serve the needs of diverse communities, fostering trust and collaboration. On a personal level, the individuals with high CQ are better equipped to navigate social and professional settings characterized by cultural diversity, building stronger relationships, and achieving greater personal growth. Two areas that have demonstrated noticeable and measurable improvements through cultural intelligence training are school districts and healthcare organizations. The following are examples of cases in which CQ training has created positive results. Community engagement for cultural intelligence in education. As the world becomes increasingly interconnected, the need for cultural intelligence within educational systems has become a pressing concern. This case study examines how one school district in a diverse urban setting leveraged community engagement to foster cultural awareness, empathy, and global perspectives among its students. The setting for this case is the Oakwood School District, located in the heart of a thriving metropolitan area. With a student population that reflects the rich tapestry of the local community, the district recognized the importance of preparing its learners to navigate an increasingly globalized world. To this end, the district's leadership team, led by Superintendent Dr. Amelia Watkins, embarked on a strategic initiative to enhance cultural intelligence across the school system. The primary challenge facing the Oakwood School District was the lack of authentic connections between the schools and the surrounding community. While the student body represented a wide range of cultural backgrounds, the curriculum and instructional practices remain relatively homogeneous, failing to fully leverage the diversity within the community. This disconnect resulted in missed opportunities for students to develop a deeper understanding and appreciation of different cultures, as well as a diminished sense of belonging and engagement among families from underrepresented backgrounds. To address this challenge, Dr. Watkins and her team implemented a multifaceted approach that centered on fostering meaningful partnerships with diverse community stakeholders. The first step was to conduct a comprehensive assessment of the district's current state of cultural awareness and community engagement. This involved gathering feedback from students, parents, teachers, and community leaders through surveys, focus groups, and one-on-one interviews. The data collected revealed several key insights, including the need for more inclusive curricula, professional development opportunities for teachers to enhance their cultural competence, and intentional efforts to bridge the gap between schools and the broader community. The outcomes of the initiatives have been both quantitative and qualitative in nature. Standardized test scores have shown a marked improvement in cultural awareness and global competence among Oakwood students, with significant gains observed in areas such as empathy, critical thinking, and problem solving. Furthermore, the district has witnessed a notable increase in family engagement and involvement, with more parents and community members participating in school events, volunteering, and serving on decision-making committees. Perhaps the most significant impact, however, has been the shift in the school's community's overall culture and climate. Students have reported feeling more connected to their peers, and teachers have expressed a far greater sense of pride and ownership in their school and community. Perhaps the most significant impact, however, has been the shift in the school's community's overall culture and climate. Students have reported feeling more connected to their peers and teachers and have expressed a greater sense of pride and ownership in their school and community. Teachers, too, have reported higher levels of job satisfaction and a renewed sense of purpose as they witness the transformative power of culturally responsive teaching and learning. Likewise, despite the inherent challenges, schools that have successfully implemented inclusive policies have reaped significant rewards. These institutions have witnessed a marked increase in student engagement, academic achievement, and overall well-being as learners from diverse backgrounds feel empowered, supported, and valued within the educational environment. The Oakwood School District's experience offers valuable insights into the role of engagement in fostering cultural intelligence within educational systems. By prioritizing partnerships with diverse stakeholders and leveraging the wealth of knowledge and resources within the local community, the district was able to create a more inclusive and responsive learning environment that better prepared its students for the challenges and opportunities of the 21st century. Cultural intelligence in healthcare organizations. The healthcare landscape is marked by an increasingly diverse patient population, each individual bringing their own unique cultural, ethnic, and linguistic backgrounds to the care setting. Effective cultural competence requires an understanding of this diversity, recognizing that there is no one-size-fits-all approach to patient care. Healthcare providers must be equipped to identify and respond to the nuanced differences that many influence a patient's healthcare beliefs, preferences, and decision-making processes. Fostering equity in healthcare. Closely related to the concept of diversity is the principle of equity, which emphasizes the need to ensure that all patients, regardless of their cultural or socioeconomic background, have access to high quality, culturally responsive health care. Equity goes beyond mere equality, acknowledging that different individuals may require tailored approaches and additional support to achieve the same positive health outcomes. By embracing equity as a guiding principle, healthcare organizations can work to dismantle the systemic barriers that have historically marginalized certain patient populations. Case study: improving patient satisfaction through cultural intelligence. The ever-evolving healthcare landscape requires healthcare organizations to navigate complex cultural dynamics to deliver high-quality, patient-centered care. These case studies examine how leading healthcare systems from the Midwestern United States have successfully leveraged cultural intelligence strategies to drive remarkable improvements in patient satisfaction, communication, and overall health outcomes. In 2018, the Westwood Healthcare System, a not-for-profit integrated healthcare network serving a diverse population across several states, recognized the need to enhance its cultural competence. The organization had observed concerning trends, including the lower patient satisfaction scores among minority patient populations, communication barriers, and suboptimal health outcomes for specific demographic groups. Recognizing the imperative to address these disparities, the leadership team at Westwood Healthcare System undertook a comprehensive initiative to integrate cultural intelligence into the organization's core operations. The primary challenge Westwood Healthcare System faced was lack of systemic approach to understanding and responding to the cultural needs of its diverse patient base. While the organization had made efforts to provide culturally sensitive care, these initiatives were fragmented and lacked a cohesive data-driven strategy. The organization's leadership recognized that to truly transform the patient experience and achieve equitable outcomes, a more holistic and strategic approach to cultural intelligence was required. To address this challenge, Westwood Healthcare Systems implemented a multifaceted cultural intelligence program. The first step was to conduct a thorough assessment of the organization's cultural competence. including an analysis of patient demographic data, staff diversity, and existing cultural training programs. This assessment revealed significant gaps, highlighting the need for a comprehensive cultural intelligence strategy. The leadership team then convened a cross-functional task force, comprising representatives from clinical, administrative, and community engagement departments. This task force was charged with developing and executing a strategic plan to embed cultural intelligence throughout the organization. The plan included the following key components: cultural competence training. All Westward Healthcare System employees, from frontline staff to executive leadership, underwent extensive cultural competence training. This training focused on developing a deeper understanding of diverse cultural beliefs, values, and communication styles, as well as strategies for effectively navigating cross-cultural interactions. Culturally inclusive policies and practices. The organization reviewed and updated its policies, procedures, and clinical practices to ensure that they were culturally inclusive and responsive to the needs of the diverse patient populations. This included the incorporation of cultural considerations into patient care planning, the recognition of cultural holidays and traditions, and the provision of culturally appropriate food options. The outcomes of Westward Healthcare System's Cultural Intelligence Initiative were remarkable. Within the first 2 years of implementation, the organization observed a significant increase in overall patient satisfaction scores, with a particularly notable improvement among minority patient populations. Communications barriers were reduced, as evidenced by a 30% increase in the need for interpretation services and 25% increase in patient comprehension of discharge instructions. Moreover, the organization's efforts to address healthcare disparities yielded tangible improvements in health outcomes. For example, the rate of hospital readmissions for the patients with chronic conditions such as diabetes and hypertension decreased by 15%. Among the organization's minority patient populations, additionally, preventive care utilization, including cancer screenings and routine checkups, increased by 20% within the same demographic groups. The success of Westward Healthcare System's Cultural Intelligence Initiative can be attributed to several key factors. First, the organization's leadership demonstrated a strong commitment to addressing cultural disparities, providing the necessary resources and support to drive the program's implementation. Second, the involvement of a diverse cross-cultural functional task force ensured that the program was informed by a range of perspectives and experiences, leading to more comprehensive and effective solutions. Finally, the emphasis on data-driven decision-making and continuous improvement allowed the organization to continuously refine its strategies and measure the impact of its efforts. The case study highlights the transformative power of cultural intelligence in healthcare settings. By prioritizing the understanding of integration of cultural factors, Westwood Healthcare System was able to enhance the patient experience, improve communication and health outcomes, and foster a more inclusive and equitable healthcare ecosystem. The lessons learned from this case study can serve as a valuable blueprint for other healthcare organizations seeking to embark on their own cultural intelligence journey. In a broader sense, the failure to effectively manage cultural diversity within organizations can have far-reaching consequences. When organizations neglect to implement comprehensive diversity initiatives, they risk perpetuating systemic biases, stifling the career advancement of underrepresented groups, and alienating customers and stakeholders from diverse backgrounds. As an experienced practitioner and educator in the field of cultural intelligence, I've witnessed firsthand the transformative power of developing CQ. Through my work as a pastor, author, and community leader aimed at racial and cultural reconciliation, I've had the privilege of guiding individuals and organizations on their journey towards cultural competence. My academic background, which includes a bachelor's degree in communications, a master's in urban multicultural ministry, and a PhD in humanities, has provided me with a solid foundation in the theoretical and practical aspects of cultural intelligence. The power of CQ assessments. In the healthcare industry, change is a way of life. C-level healthcare executives deal with new regulations, technologies, and procedures, all while ensuring the highest level of service to their clients. A stellar example of this drive to embrace change is the Sisters of Charity Hospital in Buffalo, New York. The hospital recently experienced a merger with St. Joseph's Hospital, which involved meshing personnel and practices. And as a part of the National Catholic Health System, it must accommodate corporate as well as federal and industry mandates. Under the leadership of Peter Bergman, President and CEO of the Sisters of Charity Hospital, the executive team took a CQ assessment developed by Dr. Barbara Trotteline, principal at Change Catalyst LLC. Most executive teams are change leaders, asserts Trotteline. The team of Sisters of Charity wanted to apply all their talents wisely and efficiently because, like most healthcare organizations, they face multiple challenges at the same time. The CQ assessment is a way to understand and deploy individual strengths to support the entire organization, bolster communication, and provide valuable information so everyone is working toward the same critical objectives. The 15-minute CQ assessment characterized individual change leaders according to their styles: coaches, champions, visionaries, drivers, executors, facilitators, and adapters, as identified by the emphasis on the heart, motivational, head, strategic, or hands, tactical. During the assessment, Bergman states, we all had an epiphany that you need certain competencies on a team and ideally have people on the team representing each style to lead through change. As a senior director of human resources at Sisters of Charity Hospital, David De Lorenzo is an expert at assessing the different needs of people in a changing situation. I thought the assessment did a good job of lining me up to my role and where I see myself. It validated that I am very balanced as an adapter. The other participants realized that they could come to me as a checkpoint in their decision making, and I could see them in their roles. It gave us a good opportunity for dialogue. De Lorenzo has observed that his recent hires are looking for immediate involvement and inclusion. The CQ assessment can help us involve them in decision making. We can tell what they will bring to the change process. It's a valuable tool for the senior leader. Without a lot of time committed on the front end, you get a significant insights beyond mere information. In this training, the use of personal experience and expertise is drawn on to provide a comprehensive guide to developing and enhancing cultural intelligence. Through a combination of theoretical frameworks, practical strategies, and real-world case studies, the aim is to equip participants within the knowledge and tools necessary to navigate cultural diversity with confidence and sensitivity. The journey towards cultural intelligence begins with self-awareness, understanding one's own cultural background, biases, and assumptions. From there, we delve into core components of CQ, including cognitive intelligence, understanding cultural norms and practices; motivational intelligence, cultivating a genuine interest and drive to engage with diverse cultures; and behavior intelligence, adapting one's verbal and nonverbal communication to different cultural contexts. Aside from this training, there's an emphasis of the importance of continuous learning and growth, recognizing that cultural intelligence is a lifelong journey. We explore strategies for building cultural agility, fostering inclusive leadership, and creating culturally intelligent organizations. Practical exercises and case studies are woven throughout, allowing readers to apply the concepts directly to their personal and professional lives. Ultimately, CQ training is a call to action, a rallying cry for individuals and organizations to embrace cultural intelligence as a powerful force for positive change. By developing your CQ, we can build stronger communities, forge meaningful connections across cultures, and unlock the full potential of our diverse and vibrant world. Join me as we take this transformative journey, and together let us unlock the power of cultural intelligence.